Okay, welcome to How to Interpret a CT Pulmonary Angiogram Part 2. Now I'm going to go through step by step how to interpret a CT pulmonary angiogram. What I have here is a CT pulmonary angiogram at 1 millimeter slice thickness. This is the axial plane, and I'll go through it step by step how to interpret this. First thing I do is I want to review some of the normal anatomy here. This is the main pulmonary artery. Here's the right pulmonary artery, you can see there. And this is the left pulmonary artery. Other things here, I have the aorta here, the ascending and the descending here. The other main structure I want to look at is basically the left atrium, which is here. The left atrium receives the pulmonary veins. Now, one major thing about interpreting these studies is we want to make sure that we are not confusing a pulmonary vein for a pulmonary artery. So what I'm going to do is talk a little bit about a few rules of how to make sure you can tell which is which. So the rules basically for interpretation and to make sure that you're looking at an artery, not a vein, is when you're looking in the upper lobes, and the left, that means the upper lobe excluding the lingula, the pulmonary artery is in general going to be medial to the bronchus in the upper lobes, and the left upper lobe excluding the lingula. In the middle lobe, lingula, and both the lower lobes, the pulmonary artery generally is going to be lateral to the airway. So that helps you localize when you're in the axial plane. The other thing to keep in mind is that if you follow the vessel, you have to see that it follows back and connects with the main right or left pulmonary artery. If it follows back to and it actually ends up being continuous with the left atrium, which you see here, then you know you're in a vein and you have to go back. So the other thing to know is that the pulmonary arteries branch exactly along with the bronchial segments. So you need to know the bronchopulmonary segmental anatomy. If you don't know that anatomy, you can review that anatomy on another video and then come here. So let's go step by step. So first thing I do is first I look at the main pulmonary artery and exclude clot of the main pulmonary artery, like a saddle embolus. Make the patient safe first. So that's the first step. Then I look at the main right and left pulmonary arteries. So I'm looking at the right here, and I'm excluding a major large clot in there. I'm looking on the left now. So now I'm going to go step by step and look at the lobar segments and the segments, and then I'll try to see if I can go subsegmental. So here you can see here I'm in the right. I'm following here on the right. I'm going into the right upper lobe pulmonary artery segment. I just widen the window there so I can see through the contrast bolus. That helps me see for more subtle clots. And as I scroll up, you can see here, this is the airway. This is the pulmonary artery medial to the airway. As I said, we're in the upper lobe. I'm just following along here. I can see multiple branches here. I can see this coming anteriorly, that's the anterior segmental artery. This coming posteriorly, the posterior segmental artery. And as I follow up, I'm basically widening my eye, looking all throughout here, looking for anything that looks like a filling defect. Any part of the contrast column that is completely blocked out, that would indicate a clot. So I'm not seeing anything. I'm going to trace myself back, and now I'm going to try to do the right middle lobe. So I'm coming back here centrally. I'm just going to adjust the window again. Again, widening the window so I can see through that contrast bolus slightly. Now you can see here, I'm seeing the pulmonary artery coming out here. The middle lobe lives in this quadrant of the lung, or a section of the lung. So I'm looking for those branches here. I can see two branches here. And let me just check to make sure. Now we're in the middle lobe, so they should be lateral to the airway. And I'm just going to switch my windows. And you can see here that this artery is just a little bit lateral of this airway. These are the middle lobe segmental structures, bronchopulmonary segments. Putting it back to the different window to look at the arteries. I'm basically looking at this artery and this artery, the middle lobe segmental arteries. And I'm just trying to look for any filling defects. And then I'm following out here, I'm looking for any subsegmental clots. Any areas of that contrast that doesn't fill, which would indicate an embolus. So I'm not seeing that. I'm going to trace myself back to now I'm going to do the right lower lobe. So here I am again. There's my middle lobe segment, pulmonary arterial segments. I'm going to follow right here. Now you can see here this branch coming off right away. This is the right lower lobe pulmonary artery. The first branch is going to be the superior segment. So I'm looking there, and you can see it branching right away into subsegmental. So I'm excluding embolus there. You can see here the right lower lobe pulmonary artery is kind of chunky, and it's nice to look at. And now as we follow it, I should see it branching into the four basilar segments. And I see it there starting to split up. Again, keep in mind, now you can see here, this is the pulmonary vein. You can see that draining into the left atrium here. So make sure that you're not looking at that. You're looking at these structures here, which is your pulmonary arteries. And now I'm just widening my eye again, looking in this whole section of lung, looking for any thrombi. So you can see that the contrast flows all the way out to the base. So there's no pulmonary embolus. So now I back up, do the same thing on the left. So here I am at the left main pulmonary artery. I'm going to come up and try to do the left upper lobe. So here's my left upper lobe branch, and I can see the pulmonary artery is branching into an anterior and a apico-posterior. So as I come up, and then make sure this vessel here is actually going to be a pulmonary vein. This one right here, you see it's not continuous with the left pulmonary artery. And if I follow that down, you'll see it go right into the left atrium. So there it goes. Anyways, coming back up. So at this level, I'm just looking for any filling defects now. And if I see any filling defects, I'll trace them back to see if they end in a pulmonary artery or pulmonary vein. We're not seeing any pulmonary artery filling defects. So I've done the left upper lobe. I'm going to do the lingula. So again, it mirrors the middle lobe on the right. So here's a lingular branch of the pulmonary artery. So I'm going to keep coming down, and there's another lingular branch. This is a pulmonary vein. Again, I'm just following, I'm widening my eye, looking there, looking for any clots. Not seeing any. Now I'm going to do the lower lobe. So here I am at the left main again. You see this branch coming posteriorly, that's going to be the superior segment of the left lower lobe. So I'm going to look at that. I don't see any clot. Now I'm going to start coming down. This is the left lower lobe pulmonary artery. As I'm coming down, I'm seeing branches coming off, and I'm widening my eye, looking for any thrombus or clots or any filling defects, and I'm looking for any pulmonary embolism. So I'm not seeing any of that. So basically we have a negative study, and basically went through step by step, went through each lobe and each pulmonary arterial segment and looked for thrombus. So you can safely say that there's no pulmonary embolism in this patient. So that's a negative case. In the next segment, I will show you some positive cases, and then you'll have a reference point for what a positive case and a positive pulmonary embolus looks like in contradistinction to this negative study. Thank you.